Hello and welcome to this virtual ASCO. I'm Professor Fred Saad, Professor and Chairman of Urology at the University of Montreal, and I'm the Director of GU Oncology at the University of Montreal. It gives me tremendous pleasure to report on a very important study that is being presented at this year's ASCO, and that is the final analysis in terms of overall survival of a very important study, really one of the leaders in non-metastatic castration-resistant prostate cancer. So the SPARTAN study was a very simple design of patients with non-metastatic castration-resistant prostate cancer at high risk of becoming metastatic. So patients who had very rapid doubling times of less than 10 months, failing ADT, but no evidence of metastases on conventional imaging, bone scan, and CT scan. So these patients were randomized 2-to-1 between apalutamide and placebo. And patients were followed very intensely with imaging on a regular basis until the appearance of metastases. And that was the primary endpoint of metastases-free survival. And this was already reported and published in the New England Journal of Medicine 2 years ago, that apalutamide was able to delay metastases by over 2 years compared to patients on placebo. And when patients developed metastases, they went on to the best available therapy that was available to them, and were even offered abiraterone in the trial. And so this was a very ambitious endpoint to be looking at overall survival. And we already had some impressions that this was probably doing a lot of good to be treating patients earlier than waiting for the appearance of metastasis. Why I say this is because we already looked at PFS2, which means the second progression. And this is to get an idea of whether the patients who had treatment at the time of metastases were able to catch up to patients who started in the non-metastatic CRPC setting. And we saw that this was a 50% improvement in second progression in patients who received upfront apalutamide compared to patients who had started on placebo and got effective therapy at the time of metastasis. So we were already quite encouraged, but obviously overall survival is an extremely high bar in patients who got very effective therapy early in their metastatic CRPC state. So we already at ESMO reported that we were going very much in the right direction with a 25% reduction in the risk of death, almost very statistically significant. And this year at ASCO, very importantly, we have now long follow-up, 52 months of follow-up in these patients. So really the longest of follow-ups in these kind of studies, with 428 deaths, so really reached where the final analysis was planned to take place. And really, strikingly, the results are very positive. So patients who start in the non-metastatic CRPC setting with apalutamide, compared to patients who started on placebo and then went on to effective therapies, we saw that patients on apalutamide lived 73.9 months compared to the placebo patients who lived 59.9 months. So a 14-month improvement in overall survival. This is more than 3 times the survival advantage when we treat patients in the mCRPC state. Really striking that even though patients get effective therapy at the time of metastases, we still see this over 1 year improvement in overall survival. And this is even though patients in 19% of cases crossed over from placebo to apalutamide. And if we censor the study for patients who were naive to apalutamide in the placebo arm, the actual improvement in overall survival is 21 months. So truly, I think many of the question marks about the relevance of metastases-free survival are now, in my mind, eliminated. That clearly when we start in the non-metastatic CRPC state in high-risk patients, we clearly improve the delay in metastases, which leads to the morbidity. but we also very significantly improve the overall survival, which is critically important. The bonus is that in terms of quality of life, we already published the results showing that we don't affect quality of life in patients who are treated even though they are asymptomatic with a drug like apalutamide. We also saw that patients with longer follow-ups, now we have statistically significant improvement in time to cytotoxic chemotherapy. And looking at adverse events, now with over 50 months of follow-up, we see that we don't see any difference in terms of long-term adverse events with the use of a drug like apalutamide in these patients who need treatment. So in conclusion, really very happy to have been part of this important study. This is an important landmark in how we should manage these patients with non-metastatic CRPC immediately and in the future. So thank you very much for your attention, and I hope you have a very good virtual ASCO in the next few days.